like basic healthcare. And one reason for that is the high cost to individuals for access to healthcare. Isn't healthcare a right? Every year, insurance-based health systems steal this right from so many of us. I'd like to tell you why a publicly funded system treats its patients in a far better way. Okay, so what is a publicly funded system? It's like the NHS. Everyone who earns more than a certain amount pays tax towards the nation's healthcare. And even if you can't pay taxes, someone else's will pay for you to be treated. Everyone, even an unemployed person, has access to good quality healthcare. It brings us together by everyone who can, contributing to a nationwide system. This brings safety, effectiveness, and fairness. Let's now contrast this with an insurance-based system. The most prominent one we can look at is in the United States. In the US, individuals are forced to pay for their own healthcare by buying insurance or paying once you've received treatment. Health insurance schemes don't cover everything though, and can be very expensive. In the UK, you wouldn't think twice about seeing the doctor if you have a problem. But for many in the US, routine visits are darkened by a cloud of fear over money. High healthcare costs are causing Americans to become more unwell from delaying, avoiding, or stopping treatment. Medical debt forms part of the reason for over 60% of people filing for bankruptcy. Most of them are insured, so even insurance will not save you from the clutches of debt. In 2019, 137 million Americans struggled with medical debt. That's out of a population of 330 million. Does it seem normal to stop your treatment, especially if you have a life-threatening disease? If you didn't have insurance, you would be forced into debt. And in the US, over 28 million people face this dilemma. For these people, dangerous illnesses can leave an unerasable mark on people's lives. This insurance scheme that is built on profit for companies has led to stories that people may think could never happen in today's world. A man named Alex Smith had to ration his life-saving insulin because he couldn't pay the $1,500 a month needed for it. And just a week afterwards, he died. Is this really acceptable? 25% of Americans say they or a family member has delayed treatment for a serious illness because they just can't afford the cost. Families should not have to make these choices. They should not have to endure these struggles. It puts everyone at the bottom of a slippery slope that they will never be able to climb. A healthcare system is not competent if it forces people to make a choice between debt or death. In a world that thinks it's so advanced, why does this happen? Now let's return to the NHS here in the UK. It treats patients very differently. It treats them as real people who need help, not just profit opportunities to exploit. It doesn't matter if you're rich or poor. We don't have to pay £200 for a simple GP visit. And for an ambulance ride, we don't have to pay up to £2,000, 3 times the average weekly wage. Although there can be long waiting times, people get their treatment. Now back to the people under the pressure of an insurance-based system have to face constant anxiety, struggle, and fear. It's unimaginable, the trauma that they have to go through. So, a healthcare system isn't about putting ill people into the corner of a boxing ring, but it should be about burden-free, fair treatment. A system that does not pile the burden of money onto you is a system that we need. A system that pulls innocent people into possible endless debt, can drag away their houses and leave them on the street, has no place in our world.